So in a nutshell, that's more or less our agenda. It's still coming together in some pieces, but that's the broad view. And I was hoping now to kick it over to our two panelists here if they want to talk about what's on their agenda. And I think, there's obviously some interaction between what VBSR wants to work on and what Senator Pollina and Representative Klein want to work on. So, Senator Pollina, do you want to start off?
Sure. I guess the easiest thing for me to do would be to just sort of throw out, because I have a short list of ideas, and just without getting into a lot of detail on them, and then we can talk about them. And obviously, part of what I want to know is what you folks are interested in. So I don't want to repeat what Dan said, but clearly healthcare is, I presume I will be on the healthcare committee again. I was last time, and he outlined the issue pretty well. There had been talk before about possibly implementing a single-payer system in 2014. In the meantime, well, let me say this, and maybe you already know this, but we have to set up this healthcare exchange. That's federal law. If we don't do it, the federal government's going to come into Vermont and do it for us. What our plan had been, or the grandiose plan had been, is that we would set up this exchange, but then we would ask the federal government for a waiver so we could do away with the exchange and move towards what we conceive to be some kind of single-payer type system. That's not going to happen in 2014. You might see in the back of our minds, you may remember there was talk about that because the federal government, we were hoping, would give us the waiver. The waiver will not come anytime before 2017. That's become pretty clear. So the next couple of years, we will be dealing with the exchange. And there is a problem with the exchange is something that is essentially required of individuals and businesses with 50 or fewer employees. And there's a whole list of subsidies and tax credits and whatnot that make the exchange somewhat attractive to people. See, frankly, I think the exchange is just a distraction from what we really want to do, to tell you the truth. We have no choice. But as Dan mentioned, there are a lot of people who are going to get a big increase in their payments when they go into the exchange, because the exchange is not going to be as good for people who are on Catamount or VHAP. So if you're in Vermont, one of those state programs, you're paying low rates, you get low out-of-pockets and few deductibles. That's going to change. So you're going to pay a significant amount more, some of those people, when they go into the exchange. So the question is whether we as a state are going to do anything to hold those people harmless. And it's unclear to me right now. I mean, the governor's position has been cloudy at best. The thing to keep in mind is that they say it might cost about $18 million to hold those people harmless. We will no longer be paying their support for Catamount or VHAP, so the state is going to save close to $18 million as well. So on the one hand, they say, well, it'll take $18 million to fix that situation, and the governor says, we don't have that money. On the other hand, we're going to save close to $18 million because we're not subsidizing them in VHAP or Catamount anymore. So it would be pretty simple to simply say, well, we're going to take the savings and put it into helping these people, but clearly, that's not the strategy that the administration is talking about at this point. So I expect there'll be a pretty big argument over that, and we'll need people's support because, number one, it's just bad because if people see their bills go up or their healthcare expenses go up that much, they're not only going to have more of an economic strain, but they're not going to probably sign up for the program. They're not going to go into the exchange. So, even though theoretically we're all going to have health insurance, people will not. So you run into this whole problem of people not getting the care that they need, or just refusing to sign up for insurance that they can't afford. So that's bad in itself. The other thing that's not so good about it is it really puts a real damper on people's enthusiasm for healthcare reform. If you're being told, well, this system is going to make things better for you, and on day one your payments go up, you're not going to really think that any kind of healthcare reform is very good. So then we're all going to say, trust that single payer is going to be even better. And people are going to say, well, yeah, you told me that last year, and now you're making me pay more. So it's an economic problem, but it's a political problem, I guess is what I would say. And I think we need to be very conscious of that.
I just want to stop you for one moment here. I have a chart here from Vermont Campaign for Healthcare Security who's working on this issue. Just for example, if you're an individual making about $33,000 a year, that's about 300% of the federal poverty level. And you're enrolled in VHAP or Catamount, you're paying about $3,500 a year for your health care right now. Under the exchange, that cost will jump to more than $9,000 a year for that individual, almost about 3 times. So that's pretty shocking. You know, you go down to a person making $16,000 a year in VHAP or catamount, they're maybe spending about $600 a year because their income is so low. In the exchange, they're spending almost $3,000 a year. When you're making $16,000 a year, that's $3,000 you don't have. So it is a very big issue and a big concern. There's a lot of lives here on the line. Sorry to interrupt.
No, I'm glad you made that really real with those examples. The other thing, in a tangential way, at least in my mind, I want to also let people know that the administration is planning what I would consider to be some significant cuts in programs for people with developmental disabilities. You know, part of the problem is that there are more people in need, so instead of finding a way to pay for those more people in need, we're going to cut it for everybody in order to give everybody a little bit of care, theoretically. And I think that's another budget argument that is not directly, it's healthcare related, but it's not so much to be in the healthcare committee, but it's something that is really important to me, and I think we need to keep our eyes on as well. So in addition to healthcare, the other thing that Dan said, which is true, is that I think a lot of the discussion around healthcare this session will actually be in the finance committee, because it's going to be more about how to pay for the exchange and how to get ready for the menu of financial choices. So the healthcare committee will deal with those things, but we will actually kick them down the hallway, because we're not allowed to make those kinds of decisions about financing. We could say, this is what we want this program to cover, but our committee doesn't necessarily talk about how to pay for it. A couple of other things that I would just mention. I'm going to introduce legislation again related to the development of the state bank, and there's a couple of different ways to go about doing it, which I can describe if people are interested. One is an expert panel to design the state bank for the state of Vermont. There's a second bill that's going to go in, which is a little different, which basically calls for consolidating all the state's lending and financing and grant-making programs into one office, and then to look at how the state goes about procuring our banking services and whether it would make more sense to stop contracting that out, which essentially is what we do, and bring that in-house. So it's a slightly different way of looking at the same kinds of issues. I've also kicked around the idea of setting up a renewable energy bank for the state as an indicator as to how the state could get into some level of banking. So the other thing I'm going to do is put in a bill to make the state commit itself to restoring funding for our state college. Well, not restoring funding for our state colleges, but making state colleges more affordable, and then appointing a task force to figure out how to do it. Back in 1980, if you look at a chart, in 1980, when you looked at the cost of going to a state college, tuition picked up half the cost, and the state of Vermont paid the other half the cost of that education. And since then, the lines have diverged, and now the state picks up about 12%, and tuition picks up about 88%. So we're basically saying we want to go back to the future. We want to, at a minimum, go back to where we were in 1980 when the state paid for half the cost of a college education. We don't know how to get there, meaning we don't know where the money will come from. But the bill is going to the bill is going to ask the state to make a commitment to reach that goal and then work towards finding a way to do it. I'm also going to introduce a bill that says that every time we increase funding for prisons, we have to have a similar increase in funding for state colleges. We're also going to make kale a state vegetable.